Hi, my name is April Winter, and I'm an athletic trainer at a boarding school in central Massachusetts. I chose to do my ARP on best practices for interprofessional collaboration between athletic trainers and emergency services in New England Preparatory School Athletic Council, NEPSAC member schools. My faculty advisor was Dr. Nikki Harris. The project goal and the focus of this was to develop best practice guidelines for athletic trainers and emergency first responders collaboration in secondary school setting. It's important that we work to improve the interprofessional collaboration and communication during athletic event emergencies in order to improve overall patient care. I felt as though this was lacking. There really was not any best practice guidelines that were in the literature when looking to determine how we can improve these types of things. It took several years of working with our own emergency first responders within our town to realize that we were lacking. And over the past 10 years or so, we've worked really hard in improving this, and we have found that patient care has increased. Our communication has improved. We can read each other without really needing to speak. We are able to debrief following incidents to improve for the next. And I felt as though I wanted to bring this to other athletic trainers within NEPSAC so that they can provide the best possible care for their own patients. In making these best practice guidelines, it was split into a multitude of different sections. One of the first sections was in regards to personnel. It's going to be important that the athletic trainer internally identify who is responsible for emergency planning and coordination. Is it the athletic trainer? Is it the athletic director? Is there a security director on campus who you need to include? Does the headmaster need to be involved, or is the headmaster the one who is responsible for that planning and coordination? Once that individual is determined, then the athletic trainer can work with that individual to go through this guideline and this checklist in order to best provide for their institution, for their patients. It's important that this personnel is identified for accountability, timely communication. It really streamlines that checklist completion to allow the athletic trainer to make sure that we know who it is that we're speaking to, when we spoke to them, how you spoke to them, what was decided. Can then turn around and place that information in the document of who, the name, the phone number, the email, so that everything is in that checklist in the document. Once that internal personnel has been determined, it's important to then look externally. What's the proper alignment of communication, the response protocols, the resource expectations that the institution needs in order to figure out their emergency first responders? What type of fire department, police department, EMS service do they have? Is it private? Is it municipality? Is the police county, state, sheriff, municipality? What does the fire department look like? Who is going to be responding to these calls? Once again, you want to determine who the contact is, what their position, the phone, the email, for each of those individuals, for each department. Again, this streamlines the process for that athletic trainer to be able to make this process as easy as possible. Once the identification of the internal and external personnel has been completed, it's important to identify and classify the different types of incident. It's important because clear and consistent definitions means that there's going to be appropriate and timely responses. Every institution is different. A secondary boarding school is going to be different than a public secondary school. A secondary day school that's in a boarding school conference is going to have a little bit different needs than a primarily boarding school. Because of that, it's important that the internal criteria for what the institution is going to consider a critical incident versus a non-critical incident or a transport is defined so that those definitions can be documented and shared with the emergency first responders, so that there's understanding amongst all the parties. There's reduction in the ambiguity. There's coordinated decision making. In a boarding school, you might need to call an ambulance to transport an athlete, a patient, to the hospital for a broken limb that is not going to be considered a critical incident, but you are still activating the emergency action plan in order to achieve this goal. So when making that phone call to the emergency first responders, you have that clear and concise definition to let them know that, hey, listen, this is a transport, this is not a critical incident, but we still have to initiate our emergency action plan. So having that incident classification is extremely important. Putting together the communication plan. It needs to be clear, it needs to be consistent, it needs to be predetermined. If you are trying to figure out who you're going to communicate with, how you're going to communicate, what those definitions are, and you don't have that completed beforehand, there's going to be ambiguity, there's going to be misunderstandings, there's going to be delay in the response times or the response to take care of that athlete. Identify those designated points of contact. How are you going to contact them routinely? Is it going to be via email? Is it going to be a phone call? Is it going to be in person? How is it going to be during an emergency? Make sure that there's a common understanding between you as the athletic trainer and the emergency first responders of that critical incident, non-critical transport. If this communication plan is put together appropriately, it's going to be efficient. There's going to be a decrease in the miscommunication. You're going to strengthen that interprofessional collaboration because there's no misunderstandings as to who is supposed to be doing what, how they're supposed to be doing it, who is going to be in contact with who. As far as education and training, it's important that an athletic trainer understand the scope of practice and the expectations that an EMT has, that a paramedic has. What's the police officer supposed to do when they are the first one on scene? What is the firefighter doing when they arrive on scene? Role play these scenarios. Practice the language that you're going to utilize. Practice the hand signals that are going to be utilized. Make sure that the emergency first responders understand the scope of practice and the expectations of the athletic trainer. Again, this results in that decreased risk of miscommunication, misunderstanding, and non-cooperation between the parties. The last thing that an athletic trainer wants is to feel as though they're not being heard when they're trying to take care of their patient. If you have that joint education, that joint training with the first responders, then there's less likely for these things to happen. You can role play the scenarios so they can understand the language that you're using, and you can understand the language that the first responders are using. You can utilize hand signals. You can share what different inventory is being utilized between the parties. It's really important that that patient stays at the center of care. And if we educate appropriately and we train together, then we have the best possibility of keeping that patient at the center of care. In terms of inventory, we want to make sure that we understand as athletic trainers what essential equipment and supplies we have available and accessible, as well as what does the police officer who arrives on scene first, what does he have or she have within their cruiser? What is on the fire truck that arrives? What is in the medic truck? What is in the ambulance? Who is going to have which items? What are must-have items and what are some supplementary ideal items to have? What are those things that are required for an immediate response versus those things that are going to enhance effectiveness and efficiency of the call? Who's going to be responsible for each of those items? Is the AED going to only be on the ambulance? Is it going to be with the athletic trainer? Is it going to be in a building on the campus? How far away from the fields is it? Delineate that responsibility for each so the parties know who is responsible for each piece of equipment. This will reduce the delays in response. It prevents confusion as to, oh, I thought you were bringing this with you. Oh, I thought you had this. And it's going to promote accountability for that equipment readiness. It's going to make sure those AEDs are appropriately taken care of. It's going to make sure that the splint bag is in the back of the medical UTV or it's going to make sure that the ambulance is bringing the combi board in order to transfer the athlete from the field to the stretcher in the easiest way possible. So again, it keeps the patient at the center of care if we understand who has what for equipment and supplies, who's responsible for the upkeep, and who is going to be bringing each of those items to the call. In terms of field plan, each facility and each field has to have a clearly defined and accessible emergency action plan. That EAP needs to be shared with the emergency first responders, the medics, the EMTs, the firefighters, the police officers. Include detailed diagrams. What are the designated access points? Make sure it's a standardized language. For us, we determined that the best standardized language was to utilize the firefighter's alpha system for which side of the building they're going to be entering, A side, B side, C side, etc. They have designated access points with their primary access point delineated, secondary and tertiary access points also delineated. The diagrams determine and show where the AEDs are located, where the athletic trainers are located. It really provides the opportunity for the emergency first responders to study and understand our campus before they even step onto our campus. And part of that joint training is them coming onto our campus and walking it with us walking them through those diagrams in person to show them the access points, to show them where the AEDs are, to show them the elevators, the gates, all of those things that are important. How are you going to distribute that, right? Make sure that you understand that the different departments have received it internally and externally. Is it going to be in a shared document, on a Google Drive, in a Dropbox? Is it going to be hand printed and updated? This strengthens the preparedness, it fosters interprofessional collaboration, and it ensures consistent and coordinated responses that might not otherwise occur if these understandings were not there beforehand. The maintenance of it all, making sure to debrief post-incident, to review all aspects of the response. Even a menial, quote-unquote menial response, such as a transport, could have some misunderstandings. So review that post-incident. You could do that internally within your own department, and if something pops out, reach out to the appropriate contact at the department that you've already identified and say that there was an issue with the response, or you felt as though you can improve it by changing an access point. It's okay to debrief for those non-critical transport incidents, and it's absolutely imperative to debrief for those critical incidences. You're checking in on the athletic trainers and the first responders' mental health. These conditions and demands that are placed on these individuals during a critical incident can have mental health repercussions, and we need to make sure that those that are caring for the patients have been cared for as well following these critical incidents. This is not something that's going to occur after every incident, but the major critical incidents most definitely need to have. The changes to future response on what worked and did not work. It's important to be open, to reflect, to be honest, to make the changes, to recognize the weaknesses of the program, to make changes, because in the end, those changes are only going to improve the response and keep your patient at the center of care. Maintenance and rehearsal of the EAPs mean there's going to be high caliber emergency preparedness. It means that it's going to be muscle memory versus trying to figure out who's supposed to be doing what because you wrote the policy and then you never looked at it again or you never practiced it. So it's really important that you determine how often are you going to check in on these emergency action plans? How often are you going to rehearse them? Who are you bringing in to rehearse them with? The maintenance is just as important as the initial development of your process. Some final thoughts is the goal of these best practice guidelines was to always keep the patient at the center of care. At no point do you want your patient to feel as though they're being pushed aside for a turf war. You want them to know that they are the center of attention, the center of care, and everybody is working together to get them the best care possible. It's imperative that everyone maintains open communication before, during, and after incidents. The more open communication that there is before and the more open communication that there is after means the during communication is going to happen without much thought, without much stress, because you know that you trained for it, you worked for it, you've been discussing it beforehand, and you know that afterwards you have made changes to better for each subsequent incident. You have to be honest. You have to be open in that reflection and be willing to change. So again, the goal of this was to provide best practice guidelines for NAPSAC athletic trainers to keep their athletes at the center of care through improving or initiating interprofessional collaboration with emergency first responders. I hope that you enjoyed the presentation. I'd like to say thank you to my faculty advisor, Dr. Nikki Harris, for her guidance in this, and hope that this has provided athletic trainers a thought towards how they can improve their own collaboration with first responders, whether they're in a boarding school or not.